Alright guys, so here's the second video in the pharmacology. You'll notice there's always going to be a lot of repetition. I always like to review, and then I like to review, kind of re-review at the very end. But again, this is the next portion of the pharmacokinetics, and we'll just kind of build upon that. So we'll kind of go kind of slow, but we'll make sure that we always hit all the important points along the way. I make a little slight error at one point in there, but I catch myself. So see if you can catch my error before I tell you that I made it and then recorrect it. So hope you liked the video, and let us know in the comment section. Alright guys, so here's the second video, and before we get started, let's go ahead and just quickly review what do we know so far. Well, we're talking about this. It's the pharmacology. We know pharmacokinetics, studied the movement of the drugs in the body, and then we went through, we talked about the gut, liver, vein, heart, lungs, back to the heart, and then the artery, and then we said, look, oral goes in the gut, has a long way to go before it gets somewhere important. IV, a little bit closer to the finish line, and then the anesthetic really close to the finish line. So obviously the anesthetic goes in quicker, so it has a very high Cmax because it doesn't get lost in all the miscellaneous stuff before it. So it has a very high Cmax or concentration with a very low Tmax. And then on the very opposite end, the slowest one is going to be the oral medication, which of course would have a very long Tmax, or just longer than the anesthetic or the IV, and then its Cmax is less because, well, a lot of the stuff gets lost along the way. And again, everything under the curve is called area under the curve, and all those, given everything else being equal, should be the same amount. But pharmacokinetics, again, has absorption, distribution, metabolism, and excretion. And basically this, we talked about the absorption. So let's now talk about the next phase, which would be the distribution. So this question reads, a new antibiotic is being developed and is predicted to be a game changer for UTIs. The volume of distribution of this antibiotic is measured at 5.2. This new antibiotic is most closely to have which of the following characteristics? Is it it's lipophilic, loosely bound albumin, low molecular weight, highly positive charge, or a strong inducer? So you're thinking, how do I solve this? Well, to solve this one, you got to have a good understanding of the distribution, how it works, and again, this is what I had found on YouTube, the way it was described. So you have to understand there's all these different, say, compartments of, in the body. And we're just going to label it like this. And this is going to be our blood plasma. Okay. This is our fat. This is our extracellular fluid. Okay, stuff that's just kind of hanging around. Then we got intracellular. And then this is everything else. They call it other, like CSF and stuff like that. So, so stuff starts out in the plasma and can go, kind of go through here, and also can kind of go back and forth between these two. But it starts. So we're just going to say everything starts out here in the blood plasma, and then, it can travel between this one and the fat. The extracellular can go between the extracellular and the intracellular, and then through all these. So in theory, you can put a medication and it can balance itself out through all these. And so if it goes through all of these things, this is the distribution throughout the body, okay? And they call it the volume of distribution. And then if you were to say, well, how many liters of water and fluid are in the body, you'd say 42 liters, okay? And then with that type of knowledge, a volume of distribution that would be considered low is going to be between, say, 4 and 8 liters. And you have to memorize that, okay? This is very important. Between 4 and 8 liters is considered low volume distribution, meaning it doesn't go everywhere. It just kind of hangs out maybe on the first phase in the blood, doesn't make it out of the blood plasma, okay? So then we have to know, well, what keeps it in here, right? What's the difference between a drug that stays here or one that easily goes throughout the body? And it's these characteristics. Number one, it's the permeability, and when I say the characteristics of the drug, but just the characteristics in general, including the drug, but it's the permeability barriers, okay? And for example, they say like in the liver, it has lots of permeability, okay? So things can kind of go in and out pretty easy, so things can go in very quickly, whereas the brain, not so much, okay? Not as much. Things don't go in. You got that blood-brain barrier and the whole lipophilic, kind of scenario. Now, what determines whether something goes forward or backwards and stuff? They call it the KC,
or equilibrium constant, okay? So K, and you'll see that kind of written out, is the equilibrium constant. But anyways, you have to start knowing these. Again, what makes something go all throughout the body is something with a very high volume of distribution. What would be considered low, between 4 and 8 liters, is going to be low because the whole body has about 42 liters. Now, we said the first thing is the permeability barriers, such as in the liver, very, very much so permeable, and in the brain, not as much. Number 2, and this is where you really got to start paying attention, it's the pH, okay, pH of compartments. Okay, pH of compartments. And if I want you to think of that as just positive or negative, and you'll see why in a second. It's an easy way to remember it. And then the number 3rd one is the binding capacity. The binding capacity, meaning does it bind to the protein or albumin, right? Very common. Does it bind to albumin? And is it a high molecular weight or not? High molecular weight or low, meaning, and also, again, protein bound. And then the last thing I want you to kind of, well, not second last, is the fat solubility. Fat solubility. And then there's this thing called the AV concentration gradient, arteriovenous AV concentration gradient, and that kind of reflects the solubility. That's really the solubility of the tissues. We can push things through, push it through. Now, and there's always a question out there that you got to know that if it has a high AV concentration, low onset of action, because stuff gets pushed into the tissue and doesn't get to its endpoint. Now, how do we interpret this? Okay, because everything looks good so far. You got the, if you took a drug or a medication, let's just put it like that, or it's injection or something like that, is it goes into the blood plasma. Now, what keeps it there? Well, when we look at the pH of the compartments, think about this. And you got this small passageway through there, right? What do you think could fit there? A plus sign could fit through this little passage, or a negative sign? All right. A negative sign could easily fit through there, right? A plus sign would get stuck, right? The thing on this piece would not allow that to go through. So what you're going to say is when something is positively charged or highly charged, it's going to stay in the blood plasma. And so that would be, a high positively charged is going to have a low, is going to be if the medication has a high positive charge, or the compartment, I say the medication, it's going to be a low, it's going to be a characteristic that it's going to have a low volume of distribution, right? That medication, if it's a positively charged, you're going to think low volume of distribution because that positive sign can't make it through. But if it was a negatively charged, boom, goes through, and a negative charge would have a very high volume of distribution, okay? The next thing, when we talked about the binding capacity or albumin, think about this. If a drug came in and was bound to something, right? So here's the drug, and then it gets bound to the protein. What's going to happen? It's going to be weighted down. If it gets weighted down, it's going to go to the bottom and just kind of sink, okay? It's going to sink, and if it sinks, it's going to stay right there. Now, if it's not tightly bound or a low molecular weight, it's going to be lightweight, and boom, it can fly through, okay? So in this situation, if it says a high molecular weight, or tightly bound to a protein or albumin, okay, that's going to be another low volume distribution characteristic, okay? You see what we did so far? All we do is take all these and say, okay, well, which ones are going to give us the low volume distribution? Well, if it's highly positive charged, because that positive sign can't fit through there, so it's going to stay in the blood plasma, so it's a low volume of distribution. If it's a high molecular weight or highly protein bound, it's going to be weighted down, so it's going to stay in the blood plasma, so it's going to be a low volume distribution. Fat solubility. Okay, think about this. What do you think could slide through there? Something that's all greased up and fat, or something that's not? If something was really fatty and greasy, it's going to slide right through. So something that's going to have a low volume of distribution is something that's not really fatty. Okay, so it would be more the, I guess, we're going to say low fat solubility. And I have to confirm that that also means like the phobic piece of that. So it's low fat solubility would have a low volume distribution. If it's fat soluble, highly fat soluble, it's going to slide on through there, right? It's going to slide on through. And so these are the, and then of course we already talked about the AV concentration gradient. It pushes it through. But if it has a high AV concentration gradient, meaning there's more on this side and it pushes it through, it gets pushed into the tissue. And there's, like I said, there's always that question about low onset of action. So, all right, so what would be considered low volume distribution? Would be something that's positively charged, something that's high molecular weight or highly protein bound, or something that's not fat soluble, okay? Those are all low molecular weight, low volume of distribution because they stay here. If I went through these and said, well, which ones are high volume of distribution, you'd say, oh, that's easy, negatively charged, low molecular weight, not highly protein bound, and fat soluble. Those are the characteristics that would have a high volume of distribution. Now, back to this question, right? The volume of distribution of this antibiotic is 5.2. So you had to know this. You have to have that memorized because what is 5.2? Oh, that's easy. That's a low volume of distribution. You know, if you didn't know this, you would never get this question right. So then all you have to do is go through all these characteristics and say, okay, which ones are indicative of a low volume of distribution? Is it medication is lipophilic? And you're like, no, because we said if it's fat, you know, if it's got the fat, it can slide on through. So it wouldn't be that one because that one is indicative of a high volume of distribution. Is it loosely bound to albumin? Wait a second, albumin's a protein, and if it's loosely bound to a protein, it's not weighted down, and it can fly through these again. So no, this is also a high characteristic of a high volume of distribution. Low molecular weight. Well, as we said, if it was a high molecular weight, it would get weighted down. So low molecular weight would have a very high volume of distribution, or a higher. Okay. Highly positive charged? Well, wait a second, that's right, because we said if it has that big old plus sign, it can't fit through that passageway, right? So if it's highly positive charge, it can't fit through, and it would have a low volume of distribution, which matches what they're saying here. And then strong inducer. This is just part of the this is more about metabolism, which we'll talk in the next video with that. So if you understand this, and you understand these characteristics of what makes it a low volume distribution versus a high, you can answer these questions that they can give you. Now, this is a lot. You know, there's no question about it, but it's a lot. But really, all you got to do, you don't have to know this whole picture thing. You just have to know, these guys, these characteristics, and mainly these guys right there, because that's where the question is going to come. They're going to say, they're just going to give you one of these two choices. They're going to say, is it positive or negative? Is it highly protein bound, high molecular weight, or low protein bound, or low molecular weight, or fat soluble, or not? That's where the question is going to come. And if you know that, you'll be all right. Okay. This one says, a fourth-year medical student is attempting to calculate the loading dose of a new medication. They understand that the loading dose calculation involves knowing the volume and distribution in the formula. They also researched that if they administer 50 milligrams of this new medication, that they obtain a plasma concentration of 0.1 liter per liter. What is the volume distribution of this new medication? Now, this is just strictly a memorize the equation, but it's something you can build upon, right? So think about this. Volume of distribution is, it's basically, it's the total drug in the body, okay? Total drug in the body, all of it in there, divided by the concentration of the drug in the plasma, okay? Now, and total drug in the body, as you know, you're going to measure that in milligrams, how much you're going to give per se. And then concentration of drug in the body is going to be in the units, milligrams, or something per liter. And the key with all this, though, guys, is you got to make sure, you got to make sure that the units match up. And I didn't do a very good job, a good job on that one, on this problem. I left that piece out, but you got to make sure the units match up. Don't get tricked because the decimal place got slid one way to the left or right. So that's all they're asking. What's the volume distribution? And if you see that and you're looking for a calculation, you better break this one out first. Now you ask yourself, well, why is this equation important, right? Who cares, okay? Well, number one, they could ask it on the test. But number two, where you really take this is because there's a thing called the loading dose, And that's where the volume, you gotta understand what the volume distribution is. Now, you're hoping that they give it to you, but if they don't, you might have to calculate it with one extra step. But a loading dose of medication is the volume of distribution times your target concentration, and you don't know which one they're going to give you on the test. And that's divided by this constant, which is the bioavailability. But if it's an IV, then it's if it's an IV medication, then it's always 1. Okay, and for our purposes, just always think of it as a 1. Okay, so you can almost eliminate that. And this is just how it just works. You have to just trust me on that. If it was oral, then it would be some number. So it's in the figuring out the loading dose, that's where you'll need this. So that's why this equation is important for you right now. Now, back to this problem. It says if they administer 50 milligrams of this new medication, which would be the drug in the body, so 50 milligrams, that's the numerator right there. They obtain a plasma concentration, concentration of drug in the body of 0.1. Okay, and it should have been milligrams per liter. Okay, so very simple. I mean, this isn't really obviously a difficult problem unless you just don't know what the formula is. And again, it's something you can build on. So if you did those calculations, you would get 500. Units cancel out, and your volume of distribution would be 500. So. So with this, if we also looked at the volume distribution, what are some things that can make it high or low? Like, despite what we already said, they also say like that can change with disease. Okay, so you can have, because what diseases? Because if you look back, and we said, well, look, if it's protein bound or not. So what diseases would cause low protein in the body? Ah, okay. Well, yeah, decrease in protein. Well, I can find that with liver disease, right? Because that's decreasing. You're decreasing protein synthesis, so liver disease can cause a low volume of distribution. Kidney disease, right? If you have kidney disease, what are you doing? You're spilling a lot of proteins in the urine, so you're eating like protein loss. And again, if there's low protein, it's low. It's not really binding. I'm sorry when I say that. So decreased protein would have. I'm sorry, I misspoke on that, didn't I? That would cause a increase of the volume of distribution, right? It's an increase. I'm trying to think about this. If I didn't have no protein, then it's low molecular weight and goes throughout the body. So disease can affect, okay? It can affect the volume distribution. If I have decreased proteins, it can increase my volume distribution, and I misspoke a second ago on that. Okay? So with that being said, it'd be 500 ml. So what have we learned? What do we talk about besides me making that mistake there? Pharmacokinetics, study the movement of drugs in the body, what the body does to the drug. We talk about the gut, then it can go to the liver, vein, heart, lungs, heart, artery, and you got to know when these guys come into the system, how that affects. If they gave you a chart, what that looks like. If they were to compare it, you'd have to know that the anesthetic goes in quick, very short Tmax, high Cmax. And then you'd compare that to the others, and of course, again, the oral has the longest Tmax, longest time to the maximum concentration, and it has the lowest Cmax. And then we talked about the distribution, because pharmacokinetics is absorption, distribution, metabolism, and excretion. And with that, we look at all the different chambers, and we say, well, what are the characteristics of that make this thing more, makes things either high volume distribution or low volume distribution. And what we said is a low volume distribution would be between 4 and 8 liters. Okay, total body water is 42 liters. And we talked about permeability of the barriers. Like the liver has a lot of slits, the brain not so much. The pH, we think of positive and negative, right? If it's positive, it's going to stay in that chamber with a low volume distribution. Binding capacity, high molecular weight, is going to stay in that chamber, low volume of distribution. Fat solubility. Remember, if it's very fat, if it can slide on through all these different ones, and so on. So, and you have to know once it goes into the next chamber, then the same rules apply. Like if it's heavy, then it might sit down in there. Again, the same rules apply to each of the chambers per se. Okay. So that is that. That is the absorption distribution. Next video we'll talk about the metabolism and excretion. Hope this was helpful.